Hello and welcome to Health and Lifestyle, your health show that keeps you informed on matters health. My name is Marie Yambo. At KBC, Channel 1 on X is where you can interact with us. And it's all about nurses. The Nurses Week is celebrated every May, and it's a special time to celebrate the men and women who are truly at the heart of healthcare. At the Kenyatta University Teaching, Referral and Research Hospital, we take a closer look inside the general ward and operating room, where healing goes far beyond medicine. It's about compassion, courage, and the quiet strength that nurses bring every single day. And as the world pauses to honor nurses, we share the story of the people who show up not for recognition, but for a simple, powerful mission: to care. Coming up in the program,
our work, first of all, is to ensure that the patients are well.
They are there when you take your first breath and when you take your last. Nurse Morris and Mjomba share their journey in the nursing profession.
I think the world has realized that this hospital is matching the global space. So this has become the fetching ground. We are losing nurses every day.
Kenya's Nurses Brain Drain. We speak to the Director, Nursing Services at the Kenyatta University Hospital. And on Good Practice, we take you down memory lane on the nursing profession. And to our first segment, behind every heartbeat in the ward is a nurse. And behind that nurse is a story. Today, we meet Morris Mutua and Norman Mjomba. Both are nurses at the Kenyatta University Teaching, Referral and Research Hospital, whose journeys reflect the strength and the spirit of thousands of nurses across Kenya. Here is their inspiring stories. Though they work in the same hospital, their roles are vastly different. Morris Mutua is a general ward nurse, and Norman Mjomba is a precision-driven force in the operating theatre. For 15 years, Morris has devoted his life to caring for patients. In the ward, he's more than just a nurse.
The first thing for a nurse is the patient, because ideally, you want to see the well-being of the patient and ultimately the family at large. So our work, first of all, is to ensure that the patients are well. And even before we start our cares, we ensure that even psychologically we've greeted our patients, how they have slept, how their day was, what the challenges they are facing at that moment. Then now you're able to address any other issue. But in our setup, you're going to find that nurses are going to ensure that patients have their meals. We make sure that patients have been given their medications. We look at them, generate to ensure that the investigations have been done. For instance, we are doing the lab works, we are doing the radiologies like CT scans, all that. So a nurse is wholesome for a patient.
He is a witness to the joys of recovery and the heartbreak of loss.
Seeing a patient achieve their health through your hands is a great achievement.
There are times when it's not about recovery, but about guiding patients and their loved ones through those final difficult moments.
What we do in such moments, you take patients through the process, because this is a process of dying. You take them through acceptance, because they are going to be into depression. You prepare the relatives and their people. You take them through that moment.
Dealing with such moments can weigh heavily mentally.
That's a psychological trauma, and we experience that as nurses. So progressively, if you lose a patient, and maybe yesterday you had lost another one, it affects you psychologically. And in that case, we go through debriefing moments whereby we discuss that it's like you are unwinding.
Just a few floors away, Norman Mjomba works in the silent precision of the operating theatre.
The nurse ensures there's a full preparation of the patient from the time the decision was made for surgery until the time the patient comes, psychological support and preparation, ensuring that all investigations and the preliminaries preparation have been done. Hence, receiving the patient, advocating for the patient, for the right surgery, right patient, right every action that is supposed to be done on that patient. Intraoperatively, the nurse ensures that preparation of all equipment, instrumentation is done, and assist the surgeons in all manner possible to ensure the patient has been served in the right prescribed surgery. Thereafter, post-op, there also nurse. There we have the perioperative nurse or the PACU nurse, who is an ICU nurse, who takes care of the patient immediately postoperatively before discharging home, or even discharging to the ward, or even escalation to critical care units.
Here, emotions must be steady even when lives hang in the balance.
I can say we live under pressure, but we always have calm down. Composure is key in our setup. But in an event, we have emergencies, like bleeding emergencies, like patient has complicated, like cardiac arrest emergencies, or any other related medical conditions, surgical conditions. This nurse is well enabled because he's trained and they are well able to handle these emergencies. So I can say that pressure overtakes us. We handle the pressure.
For him, the greatest reward is knowing he played a role in saving a life.
It's basically job satisfaction. Well, after the end of the day, you have the task at hand, you finished, and the patient progressed well and they gave good outcomes. That is a high moment for me, I can say. Recently, we had a kidney transplant, 2 pairs we did, 2 concurrent days. It's an achievement for us. And the patient are well now, they are able, they are regained back to normal life, and that's a high moment for us. But contrary, we can also have the low moments when it goes the south way. Maybe we lose a patient intraoperative or during our care, or the surgery is maybe supposed to be curative, but it doesn't cure, or you're supposed to, the expectations of the patient were not met. So those are usually not good moments, I can say.
Both men understand the mental and emotional weight that comes with their calling.
Mental health, I believe maybe the government and even the higher institutions and the concerned parties can take this matter as a very important issue to take over and maybe support these people like us, because post-trauma is very true.
Celebrations to mark the Nurses Week is a time for appreciating and recognizing the work that nurses do.
Celebrating the Nurses Week is to appreciate them for what they have been doing for the care and the health of the patients in Kenya. And this is to show the value, even as a nation and as the world and as a society, we are for the nurses.
Mjomba reflects on what this recognition truly means.
I want to encourage all nurses out there and those who are aspiring to become nurses. Nursing is a noble profession, and I can say that a nurse is not an undermined person. And it is high time that nurse is recognized and appreciated for that matter, because we have nurses who are doctors, who are scholars, who are researchers. So kudos nurses, happy Nurses Week.
And in case you're wondering how Morris got into nursing, well, it all started with a mother's love.
This was her dream. Like, she used to covet so much to be a nurse. She encouraged me a lot even to love people. We would visit hospitals with her. I would see how nurses used to look after nurses. And I said one day I would love to be a nurse. And true to that, I became one. In fact, she said that her dream has now come true through her children.
So here's to Morris, to Norman, and to every nurse across Kenya and around the world. Happy Nurses Week. You are the heartbeat of healthcare. And indeed, happy Nurses Week to all nurses in Kenya and across the world. And on Word on the Street, we just sample some of the views of the nurses during the Nursing Week.
I think nurses are very important in terms of healthcare. Most of the time, we are the first to usher people into the world in midwifery, plus other caregivers. And also, we are there as people exit from the world. So we walk the journey with our health all through. So we play a key role.
So I urge all nurses that you join us in Nurses Week so that we work together, we celebrate each other as we work together. My last message to those people who are able to reach nurses, please, we love you. Just empower us. Reach those people to pass policies that can empower nurses. Thank you.
Nurses are patient advocates. Nurses are clinical experts. Nurses are also educators. They simplify and also tell the patients what they need to do toward the support of their treatment. Beyond clinical skills, nurses provide emotional support and healing. We comfort, listen, and connect. As we celebrate the Nurses Week, may you feel seen, heard, and valued.
On that note, we take a break, but we'll be back with much more, including between nurses and doctors, who plays a bigger role. We get to hear more. Welcome back, and thank you for staying with us. And just as promised, we'll get to answer that question between doctors and nurses, who gets to play a bigger role? The Director, Nursing Services at the Kenyatta University Teaching, Referral and Research Hospital is Pamela Ntwiga, and she answers that question.
I must confirm, we say nurses are the backbone. Doctors come see the patients and go, and leave the patient with the nurses. However, I need to also clarify that we complement each other. It's difficult to say nurses can work independently, neither can doctors work independently. We complement each other, but the reason nurses are known to be the patient's mothers or caregivers is because we spend 24 hours with the patient. You're lucky as a patient to spend an hour in 24 hours with a doctor, unless you're in the OR. But that's why there's this story that nurses own the patients. Yes, we entirely own the patients by virtue of what we do, how we spend, how much time we spend, and what we do for those patients. But yes, we complement each other. There is no superior, there is no inferior of the other. One cannot work without the other.
What does the Nurses Week mean to you, and the theme of the nurses, this year's theme of the Nurses Week?
Okay, the Nurses Week comes with a lot of sentiments for me specifically, because it's a career that I chose out of love, out of need to make a difference in the society. And this year's theme, Our Nurses, Our Future, caring for nurses is strengthening economies. It's not just a slogan. It's a word, it's a statement that makes a difference in how we take care of our nurses. Taking care of the nurses, it should come as a priority because they are the caregivers. And quite often, actually in my career life, I've not had a moment where we are taking care of ourselves. And that gives me an opportunity to give back to myself. So I'm excited to give back to myself. And of course, as the nursing director, I'm giving back to myself and my team. So yes, this week has been about caring for ourselves and caring for the nurses. And I must acknowledge that this KU, as you may be aware, is a referral hospital. So we receive quite heavy, in the sense of need of care of patients, we receive quite heavy patients. And therefore, to some extent, you forget to remember, most of the times I can affirm to you, we do 12-hour shifts, and sometimes nurses forget to eat. You can actually wake up and you're running, and the day ends, you realize, wow, it's 6 p.m. I didn't have lunch, I didn't take time. So today is just about taking care of yourself. And therefore, for that, we've brought in a lot of things on board. We have had Zumba classes for the week. We have a team that is doing for us massages, pedicure, manicure, waxing, just to relax and self-groom, of course, and makeup. So remembering ourselves, we've done a lot of walking, both within the hospital and outside the hospital, to exercise and to to rejuvenate as nurses.
Are there any other technologies that now you've actually, can I say, inculcated to help the nurses take care of better care?
Absolutely, absolutely. I can confirm that we are clinical paperless hospital. I can confirm the first public hospital in Kenya that is paperless. We don't write documents, and nursing involves a lot of writing. We have computers on wheels where you can do your rounds as you enter the patient details. We are working towards getting what you call dictaphones. Some units already have them. You don't have to write, you speak through and the computer writes for you what you're doing. So yes, we've embraced technology, and I can confirm as a public hospital, we are a benchmark for many.
Yeah, talking about COVID and how stressful it was, not just for the world at large, the communities, but especially those who are the frontline workers, you know, the nurses. It was a very stressful moment. And nursing in itself is not an easy profession, you know, the pressure that comes with it and all that, the mental issues that come with it. So my question to you is, how then do you work to ensure the mental health of these nurses is taken care of? Because that's something that they deal with almost every other day.
First, I confirm that statement as true. This is a referral hospital. Unfortunately, our health demographic is not very good. People stay home until last minute. So by the time you're coming to your level 4, level 5 is quite advanced disease stage, whatever disease it is. So we receive quite sick patients. And because of that, our nurses are forever engaging with patients who probably either end of life or very critically ill, and you have to reverse the critical ill to back. So that there's lots of course, lots of burnout because of that. There's lots of course, stress, and it's a busy unit in the sense of managing very sick patients. You're always busy. So to manage that as a hospital, we've put together a program. We call it the staff wellness. I am actually privileged to be the chair of that committee for the staff wellness. And within that staff wellness committee, we've done some baseline data, and we realize what the usual issues are, mainly, especially from the nursing field. It's a lot of burnout, and of course, our nurse shortages. So to manage that, as the Director Nursing Service, I have ensured that we are within the 75th percentile of the staffing, whereby we have units which, like, I'll give an example, critical care unit. You're supposed to have 1 patient to 1 nurse. As of yesterday evening, we were able to do that. As in, we are truly getting to the point where we can say we're within the global WHO guidelines in some units, but some units is still work in progress.
Of course, it's complementary. Devolution is also another thing that came, you know, over the years, where it was just centralized with the national government. So how has that impacted the nursing profession?
It has in many ways. Let me give an example of here. Being we at KUTRRH, we are a referral hospital. So we receive patients from the devolved functions of within the healthcare space. What I see is at least there's a lot of knowledge dissemination in counties. We receive patients. I'll give an example from far-fetched county who have gone through radiotherapy, for example. That would not have happened before devolution.
I think I will be held accountable if I didn't ask you this question, but let me put it across. So there's what we call the brain drain for nurses. Our nurses are leaving the country. They're going to serve, you know, people in other parts of the world, but we still have a shortage ourselves. How is that really impacting? Because what is happening now is that it's almost like we are training our nurses for other countries, because they're not taking the nurses who are coming out from colleges. They're taking our very seasoned, our very experienced nurses. How is that affecting, you know, our landscape?
This comes as a hard one, because I'm one of the most affected DNSs. I think the world has realized that this hospital is matching the global space. So this has become the fetching ground. We are losing nurses every day, but we acknowledge that it's a growth path for the nurses, and it's hard to stop it, especially from where we sit in within the hospital spaces. And the policy is also clear. We cannot stop the nurses from growing. So what it is that we're doing is we are working, luckily we are in an institution that is training, so we are forever training. We've learned that we keep training and they keep going. So what we're doing is, as we recruit, we have the mentors, the older nurses are mentoring, so we have introduced what we call a competent-based orientation. So every nurse who comes to this hospital is assigned a senior mentor, and they work with that nurse for at least 3 to 6 months. So even if this nurse is leaving in the next 6 months, I have somehow transferred the skill, and it's working well. And I must also confirm the numbers of nurses coming from the KMTCs and the universities surpasses the number of those going out. It is for us as a country to figure out how are we absorbing the ones coming from the university.
I want to give you a chance to just say something about nurses, being the Nursing Week.
Okay.
If there's a message you want, is there something that you want to tell Kenyans about nursing, nurses and all that?
So one of the things I would say about nursing is it's one of the careers that for the longest has not been appreciated. But we acknowledge that both here in Kenya and the global space, there has now an alienation where people are recognizing the profession and appreciating the profession. I'd like also to confirm the first person who touches a human being is a nurse. And the person who gives you that peaceful goodbye during the logic end is a nurse.
And that question has been definitely answered. Nobody plays a bigger role. They are complementary. Both doctors and nurses play an important role in as far as healthcare is concerned. And on that note, we take you to a good practice today where we want to take you down memory lane on the nursing profession. Let's rewind to the 1850s. Florence Nightingale was born into a wealthy British family, but instead of living a life of luxury, she felt called to care for the sick. At the time, nursing wasn't what it is today. It was often seen as dirty, unskilled work. But for Florence, she saw potential. Her big moment came during the Crimean War. British soldiers were dying not just from their wounds, but from infections, poor sanitation, and overcrowding. Florence stepped in with a team of nurses and immediately got to work. She cleaned up the hospitals, improved hygiene, and made sure patients had proper food and care. The result? Death rates dropped dramatically. At night, she'd walk the halls by lantern light, checking on each soldier. That's how she earned the nickname, the Lady with the Lamp. But she didn't stop there. After the war, she pushed for healthcare reforms and opened the Nightingale Training School for Nurses in London in 1860. Her methods? Clean environments, trained professionals, compassionate care became the foundation of modern nursing. Today, every nurse working in a hospital, clinic, or anywhere carries a piece of Florence's legacy. She didn't just change how we care for the sick. She gave nursing the respect and structure it has today. It's always a pleasure to have you join us, and we've come to the end of the program. My name is Marie Yambo. On behalf of everyone who made this program possible, that is the production team and also our guests, the DNS, Pamela Twiga, and Nurse Morris Mjomba for sharing their inspiring stories. If you've missed any part of this program, remember, you can always catch it on our YouTube channel. See you next week.